Welcome to Flip Your Script, the vodcast from the American College of Lifestyle Medicine that is all about clinicians redefining care through lifestyle medicine. My name is Dr. Padmaja Patel, and I'm the current president of the American College of Lifestyle Medicine. I'm board certified in internal medicine and lifestyle medicine. In just about 15 minutes, we will bring you 5 key takeaways from leading experts and practitioners who are using evidence-based lifestyle medicine to transform patient outcomes. From practical strategies to success stories, we focus on the how of lifestyle medicine to empower you to make an impact in your practice and beyond. In this episode, we are joined by leaders from American College of Lifestyle Medicine's Neurology Member Interest Group to discuss the intersection of lifestyle medicine and neurology. Let me introduce our special guest for today's episode. Dr. Ali Saad is a board-certified neurologist and lifestyle medicine physician with a strong focus on the intersection of climate change and health. He serves as affiliate faculty at the University of Colorado's Climate and Health Program, contributing to education and policy initiatives that address climate-related health challenges. Dr. Rachel Dolhun is a double board-certified neurologist and lifestyle medicine physician specializing in movement disorders. She serves as the principal medical advisor at the Michael J. Fox Foundation for Parkinson's Research, where she leads medical communications and creates resources to help individuals and families navigate Parkinson's disease. Dr. Joshua Weaver is an assistant professor of clinical neurology at Weill Cornell Medical College and an assistant attending neurologist at New York Presbyterian Hospital. He specializes in peripheral neuropathy and spinal disorders, offering a holistic and integrative approach to patient care. Welcome, everyone. How are we doing today?
Great. Thank you so much for having us.
Wonderful. Good. Great to have you. We recognize that there is a significant gap in public awareness regarding the effectiveness of lifestyle medicine in managing common neurological conditions such as migraine, stroke, and dementia. So I'm really excited about our conversation today. And let me start by asking a question about general brain health. Josh, can you please explain how lifestyle medicine helps keep our brains healthy?
Well, thanks for that introduction, Padmaja. Brain health is a really broad topic, but it's a really important one. And there's been a shift, over the last several years where we're trying to focus on not only how to treat neurological diseases and disorders, but really how to promote healthy brains and nerves from the beginning to try to prevent those disorders in the first place. So, neurological conditions are really among many of the leading causes of morbidity and mortality globally. And actually, there's about 3 billion people worldwide that have neurological disorders. Once people develop a neurological condition or injury to nerve tissue, it's really hard to repair or regrow those nerves, sometimes impossible. So there's really been a push to try to prevent those diseases in the first place. A lot of people who practice lifestyle medicine are primary care doctors. And there was an interesting study a few years ago that looked into, at least for Medicare billing, like which types of doctors are seeing neurological conditions. And they actually found out that 40% of neurological conditions are actually being seen primarily by primary care doctors, more than actually neurologists. There's just too many neurological conditions out there and not enough neurologists, So it's really important thing for primary care doctors to think about. When we think about brain health, we want to think about the whole lifespan from prenatal all the way to geriatrics. And so family medicine, pediatricians, primary care doctors, they all have a role to play in this. the American Academy of Neurology actually has this brain health initiative that they started a couple of years ago. And there's, again, because of this big push, they're trying to create more research in this area and develop evidence-based guidelines for how to promote brain health. So a lot of the things they've already discussed are really overlapping with ACLM's, pillars of lifestyle medicine and how it actually affects, brain health. There are other groups, for instance, the McCants Center for Brain Health at the Mass General Hospital that is developing screening tools to try to focus on people's brain health. And we actually have an example of that. There's something called the Brain Care Score. So you can see that on the screen here. This is a tool that any doctor can use. And, they focus on, you can see those three big categories there. There's physical, lifestyle, and social, emotional. And so we look at the physical: blood pressure, blood sugar, cholesterol, BMI. You look at lifestyle, and they focus on dietary habits and nutritional habits, alcohol use, smoking, aerobic activities, sleep, and then social emotional: stress, social relationships, and meaning in life. And they actually did a couple of studies over the last few years that actually validated this score and showed it had positive predictive value for who is at risk for developing mood disorders, stroke, and dementia. So this is a really useful score that you can use to screen people, but you can also use to kind of track as you incorporate these lifestyle medicine modifications and treatments, how people do with the score to try to improve their overall brain health. So I think it's a really fascinating area and something that is growing exponentially. And I think we're going to see more and more of this, and as neurologists and as primary care doctors.
Great. Well, thank you. I think that is such a valuable information about Brain Care Score. Let's moving on to migraines. And I know there's quite a bit of evidence that diet can play a role, perhaps, in treatment of migraines. Can you please explain, Josh, the relationship between diet and management of migraine?
Definitely. So I actually, before I focused on peripheral nerve and spine disorders, saw a lot of migraine. It's very common. And it's another one of those conditions that primary care docs see more than we do, actually, as neurologists. So there is actually quite a lot that you can do for migraine prevention and also migraine treatment, much of which is diet related. There's other lifestyle medicine treatments that can be done: sleep hygiene, physical activity, stress reduction techniques. There's all sorts of things out there that, again, follow those pillars that have evidence to back them up, and they really do prevent and treat migraines. In terms of diet, I think there's actually quite a lot that you can do, and it's sort of specific to migraine, and it's an easy thing to adopt for any patient, no matter what kind of doctor you are or what kind of practitioner you are. There's a really interesting and I think well done infographic by the American Headache Society that looks at diet and migraine and puts this all in perspective in terms of all the little tips that are there. So we can take a look at that. So, a couple of things to note. One is that strict diets, don't really work for everyone. There's no single diet that's best, right? So, you can give them general guidelines, but there's nothing that's like so specific for everyone that's going to work, and I think that's important. I think some of the general guidelines are actually snacking or small meals throughout the day is really good because it prevents hunger and fasting. So people often say when they skip a meal, that's when it'll trigger a migraine. So eating smaller meals throughout the day is a really good tip. Using or choosing low glycemic index foods, I think, is really important so that you can have sort of a stable glucose level throughout the day as opposed to glucose spikes and glucose drops, because that can trigger a migraine. Staying really well hydrated. Actually, a third of migraine patients will say that inadequate fluid intake can trigger attacks. And so that's a really important one. It sounds easy, but staying hydrated throughout the day, sometimes you have to be very mindful about that. And then specific foods that can be migraine triggers are really important to avoid. So Some of the examples that they list here and some other ones. So processed foods, alcohol, chocolate, caffeine, foods high in nitrates like processed meats like hot dogs or bacon, foods that are high in tyramine like aged cheese or cheddar or smoked fish or some citrus fruits, foods with monosodium glutamate, and then, foods, a diet that's a high sodium diet can also trigger migraines. So lots of things you can do. And when people are really consistent about these changes, it can dramatically reduce, the amount, the frequency of migraines and the severity of migraines. And it might just prevent them from having to see a neurologist in the first place, which is great.
Yeah, yeah. Thank you. Thank you for sharing that.
Sure.
Let us talk about stroke, which is a leading cause of death and disability worldwide, right? Globally. We know 1 in 4 adults over the age of 25 will have a stroke in their lifetime. So, Ali, can you please help our audience understand what are the leading risk factors for stroke?
Of course, thank you. So I have a pretty short answer for this question. Stroke prevention is a huge opportunity to protect brain health and to maintain independence. And while rare genetic and traumatic causes exist, around 90% of strokes are due to just 10 modifiable risk factors, which is a surprising number to a lot of people. And all of these risk factors overlap with those of heart disease.
Right.
There's a graphic I like to show from the World Stroke Organization, where over half of stroke risk comes from high blood pressure alone. And after high blood pressure, the second biggest risk factor is poor diet. And just like the ACLM, the American Heart Association recommends a plant-forward diet that minimizes added sugar, salt, and fat.
Wonderful. And so what advice do you have for primary care clinicians on integrating this information into their routine patient care?
Yeah, so when I see patients with stroke, I like to remind them that stroke isn't really a primary neurological problem the way, say, multiple sclerosis is. It's a lifestyle disease, just like heart attacks or chronic kidney disease, but it just affects the brain. And the good news is because stroke is mostly not genetic and 90% of that risk reduction aligns with lifestyle management that primary care already does, they're already doing great things for stroke prevention. And I think what's critical for primary care clinicians is helping patients feel empowered by highlighting the essential role of lifestyle in stroke prevention with these 10 risk factors, and letting them know that they don't need to wait to see the neurologist in clinic before beginning their risk reduction strategy. Another key thing is that stroke is not just a disease of old age. In fact, 63% of strokes now occur in people under age 70, meaning that prevention needs to start early in life, just like when we're talking about heart disease prevention and metabolic syndrome. And a tip I like to give, because a lot of times people ask, well, what's a good food for brain health? How do I protect my brain from not only stroke, but dementia? And I like to encourage incorporating green leafy vegetables and berries because they both have a strong evidence base for brain health, for stroke and dementia. And getting frozen versions of these foods is both affordable and widely available. They're pretty easy to add into smoothies, right? And it's great for specific populations, like if you've got kids that are picky eaters, if you've got young adults that are trying to bulk up with protein shakes, you can add those in. It's also great for elders that need to supplement their caloric intake with smoothies, or they may just have trouble swallowing or chewing. And it's a great way to sneak those things in. And so a lot of these stroke prevention strategies are vital for dementia prevention as well, which is a common concern for many patients that present to primary care clinicians. So, it's a great strategy for both.
Great, great. I love those examples of how to incorporate these in your daily intake, right? Yeah, let's move on to talking about dementia. And, I would say as a lifestyle medicine clinician, I'm really excited to learn about lifestyle medicine offers so much promise in managing dementia. So, Rachel, I'm going to ask you this. Based on the research, can you please help us understand how lifestyle interventions can impact the risk and progression of dementia?
Well, as you said, research really is showing so much promise here. And that's really exciting for us and for our patients. There are an estimated 55 million people around the world who are living with some form of dementia. Of course, Alzheimer's being the most common, but there's vascular, there's Lewy body dementia, et cetera. So the chance that you are going to be regularly caring for someone who has dementia or someone who's at risk for dementia, a family member, these are really high. And when it comes to risk, research shows that we may be able to prevent or delay up to 45% of cases of dementia through modifiable lifestyle factors. That's huge. That's almost half, almost 50%. But yet people don't know about this, or we're not telling them, we're not giving them this empowering information. So this is laid out really nicely in a 2024 Lancet review article that shows the 14 modifiable lifestyle factors that really contribute to dementia risk. And they're familiar to so many of us, of course, being lifestyle physicians or interested in lifestyle, but physical inactivity, many of the chronic diseases that are associated with inactivity or with poor diet, like diabetes, hypertension, high LDL cholesterol, obesity, harmful substances like cigarette smoking, excessive alcohol use, even air pollution that we're seeing more and more is associated with dementia, Parkinson's, and then social isolation. So again, from the outset, the things that we are readily incorporating and bringing into visits around lifestyle can really have a huge impact. We just need to sort of underscore that for our patients and their families. And then I'd like to point out too that while not specifically lifestyle related, there is potentially a component of hearing and vision loss. So these are kind of, I say low-hanging fruit. They're easy to tackle, but because of a lack of knowledge or hesitancy, stigma around hearing aids, people may not be as willing to kind of incorporate those. And that's where we can play a role as well. And then on top of lowering risk, because you asked about potentially progression, and I think this is a really exciting area as well, that lifestyle, while we don't have medications or treatments that can stop the progression or that can cure the disease, there is evidence to show that lifestyle could potentially help us with slowing the progression from both the finger study, from Dr. Ornish's recent study, that are both incorporating comprehensive lifestyle changes in people who have mild cognitive impairment or even early dementia. So it's really important that even when people are in the early stages, we are still incorporating just as much these concepts.
Absolutely. What a powerful message that is. But what suggestions would you have for clinicians, especially when discussing dementia prevention with their patients?
I would say just make sure that you are bringing it top of mind and you're reinforcing for people. I think because this is sort of the water we swim in, we forget that everybody doesn't know this and that people, it's not like heart disease like Ali was talking about, or it's not like people don't know that this isn't a normal part of aging or that there are things that they can do. And so while this is a really common concern, while it's a really common diagnosis, there is a lot that people can do to positively influence their journey. And then second, earlier, of course, is better. It's never too late, but earlier is better. We know that these diseases, dementia is developing in the brain decades before we see the symptoms and before we see the diagnosis. So get started early, get your kids started early, talk to your grandkids, bringing in throughout the lifespan and in the whole family unit.
Yes. And I know with your role as the principal medical advisor at the Michael J. Fox Foundation for Parkinson's Research, what advice do you have for primary care clinicians treating patients with Parkinson's disease?
Well, this is one I could talk about all day, of course, but it's another one that I think is lesser known, potentially, across people, across primary care physicians, as well as people who are living with disease. And so while every lifestyle pillar really does apply to Parkinson's, it's been, I think, a shift over the past 5 to 10 years that we've seen that this is more mainstream. So encourage regular, moderate to high intensity aerobic exercise, at least 150 minutes per week. This is where we have the most evidence in Parkinson's, including some from small randomized controlled trials. So there's evidence to suggest that this type of exercise could actually slow the progression of disease. Now, just like with dementia, we don't have anything that's proven to cure the disease, to reverse it, in Parkinson's, even to slow it. So this is really the only thing we know of that can do that in Parkinson's. And then on top of that, it also helps many of the motor symptoms, so mood, cognition, sleep, fatigue, pain, where medications often fall short or don't adequately treat those symptoms. And then, of course, it improves quality of life. In a disease like Parkinson's, or, even in dementia, like we were just talking about, where it feels, it is this incurable chronic disease where you feel like you don't have control. These tools are so empowering, and they give people a way to take action and to take control to positively influence their journey. So how exactly I encourage physicians to support their patients is, one, like I said, tell them about exercise. Don't assume they know. Encourage them to find something that's safe and enjoyable. So I always say the best exercise is the one you will actually do. So you might have to experiment or try a couple different things. Remind them that it's more than the aerobic or the cardio exercise. While that's really important, it is important as we're aging or as we live with Parkinson's to also be bringing in strength and flexibility and balance. And then, as we always talk about in lifestyle, address the how of it. So I always say I've been saying not everybody knows to exercise, but for the most part, people know, when we tell them, yes, we should exercise. It really comes down to the how of it. So how when life gets in the way, but especially in Parkinson's, where your symptoms might be impacting your sleep changes, your fatigue, your, whatever it is that's actually getting in the way of exercise. Talk about that, work around it, get a physical therapist, Parkinson's classes, resources like a guide on exercise I wrote for the Michael J. Fox Foundation. Those resources and supports are out there. We just have to help put them around our patients.
Great. Wow. Well, this has been a very informative and insightful conversation. Unfortunately, that's all the time we have for today. And I want to thank our guests for joining us and sharing such invaluable insights. Ali, Rachel, and Josh, it's been a pleasure having you here today. And thank you for tuning in to this episode of Flip Your Script. We hope today's conversation has inspired you with practical insights on how lifestyle medicine is shaping the future of patient care. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring clinicians who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. I look forward to seeing you in the next episode. Thank you.